Hello, everyone. Myself, Dr. Komal, and we have Carolina with us.
Hello,
Based on the
everyone.
last video, yeah. So today we will be discussing about all the medical metabolic disorders and chronic problems that Carolina specializes in, and she will tell us a few of the examples how Ayurveda can help in some of the diseases. So let's get started with Carolina and help increase our Ayurvedic knowledge.
Hello, Dr. Kamal. As you can see, I have snow in my background because it's so
Yeah.
hot right now in Europe. This is the
Yeah.
only way to really, truly cool down. Okay, so in our last recording, we were talking about the possibility of signing up for consultations with us. In case of Dr. Kamal, any type of health and mental problems, gynecological problems, fertility. In case of signing up with me, metabolic problems, digestion, and of course, diabetes type 1 and type 2. So, and after that, we got some questions regarding, yeah, but why, since we have Western medicine, why would we sign up with you? What additional benefits can a patient get, right? Signing up
This
if
is a
you
very
already go
important
to a
question.
doctor. Yeah.
Yeah, that people ask. So it's better to answer them so that they have that confidence and know how Ayurveda works.
Yes, exactly. So I am a big fan of functional medicine right now, a really popular branch of Western medicine, and that really focuses on our entire body using the newest technology, biomarkers, and analyzing everything in detail. And doing this also per patient base, because sometimes if you have heart problems, you get this type of medication. If you are depressed, all of us get this type of medication. If we have metabolic problems, we may get Ozempic, all of us, right? So, functional medicine, along with Ayurvedic medicine, really focuses on the individual. What are the imbalances that we have? How can we strengthen our bodies, right? And also, I am a big fan of functional medicine because functional medicine always says that Western medicine it's really good for trauma, but for chronic diseases, you have to really look at the bigger picture.
Exactly.
And right, and Ayurveda gives this bigger picture. So. Today, I wanted to share with you two cases of my patients. First patient number one is 42-year-old male. He's a little bit overweight. He loves to eat food, mostly processed, unfortunately, and ultra processed. And all of this years of stress at work and the quality of the food, also not moving not too much, led to IBS. So he has irritable bowel syndrome. And
Very, very good topic you chose because it's getting very common nowadays and people are, it's difficult to diagnose as well because initially they just think of it as diarrhea or constipation, but it's very important to diagnose what is it exactly. So yeah, it's
exactly.
good. It will be
That,
good to
that's
hear from you.
That is a very, very important question that you mentioned because there is no really per se diagnosis for IBS, right? If you have for many years chronic problems with either diarrhea or constipation or a mix of both, you have bloated stomach, before you go on a big project, you may have stomach pains, stomach cramps, right? All of
Yeah.
this for many years can be
Sometimes
diagnosed as
bleeding with
something
the
else.
stools. Yeah,
Exactly.
bleeding. Yeah,
So this is exactly what my patient experienced. My patient experienced year. I think he was for like 3 or 4 months put on the antibiotics,
yeah.
and because they thought that he has some kind of an infection or bacterial infection in his guts. After the 3 months of antibiotics, of course, he was even worse off. So when he came to me, he had problem eating. He ate ultra processed foods because he believed that those are the only food that he can really digest. So he would eat pancakes with
All bakery.
yes, with blueberry jam, not even blueberries, because he was afraid that after blueberries he would have a totally bloated
Yeah.
stomach. For lunch, he would eat mashed potatoes, totally artificial from the powder, and then he would have some kind of a semi-processed hamburger with fried broccoli and things like this, you know. Yes. So, how can in this extreme condition, because he also had anemia, beginnings of anemia, his body was not absorbing what he was eating, and he was eating also poor quality foods. So,
Yeah.
to start with, even if his body was absorbing everything that he was eating, still he would not get enough. So,
Because
and
of excessive bleeding, I think most of the IBS patients land into anemia. And what I have seen in my experience is that more than the pathological reason, it's psychological. The IBS is psychological because people under stress, they eat like in a very hurry, going to office in the morning, and
yeah.
food is not digested properly, and they tend to eat more meals what their body needs. So that's a very common scene what I have observed in my patients. So yeah,
That's exactly it. And because he ate very quickly absorbable foods, simple carbohydrates, his glucose curve was up, and then after half an hour to an hour down, and then up and
right,
down. And he was on
right.
the roller coaster. And whenever he was going down, his brain was telling him, "Oh my God, you are hungry. You are
And
going
you
to
need
faint."
again carbs or sugar. Yeah,
Exactly. So then he developed also insulin resistance, which is obvious in his condition. This is 15 years of really going through a doctor from one doctor to another.
that's the
So
story of every IBS patient. Yeah,
yeah, so this was he was at sometimes, particularly after he would take for a month or a couple of weeks antibiotics, he would get constipation, and
mhm.
then slowly he would start eating broader range of foods, and then he would start get diarrhea. So he had mixed of both of the worlds. He had a
That's
little bit
the
of
cycle goes on.
vata and a little bit of pitta, a little bit of dryness in him, and then he had also fire in him. So we and also the nutritionist, Ayurvedic nutritionist, we know that the real world is really hard to change. So we always introduce changes to diet slowly, finding the best substitutes that work. So I know that his breakfast, his favorite breakfast, was ultra processed, but it was sweet. So I tried to come up with something that is very similar, and he actually likes grains. So he started cooking millet with
Yeah,
coconut
great.
milk, a little bit of dry fruits, with a little bit of nuts. I know that he was malnourished, so I asked him to do every day 8 almonds and to grind those almonds with the millet. And then he was just so fond of the maple syrup that I asked him to buy the Canadian true maple syrup and just one spoon on top.
Yeah, very,
Okay.
very, very careful about that.
Exactly. So this is a compromise. This was not maybe ideal for him because he had insulin, he developed insulin resistance, but it
Mhm.
was all natural. It was not processed foods. So after that, he was surprised that he said, "Wow, this is I'm eating much less volume-wise than I would eat with pancakes, yet I
Right.
feel full." And then I also asked him after a couple of days, slowly or strategy, to add 1 teaspoon of ghee, of clarified butter that would actually clean and
Filled with dryness because of the
exactly,
vata.
exactly his vata in his guts, in his colon. So yes, so that was this. And because he had a lot of constipations, then we also focus on the daily routine, right? In Ayurveda, we've observed that our strongest enzymes and digestive capability is happening between 12 and 2 p.m. This is our digestive fire time. So I asked him to change because, of course, his main meal was
It's
at
really
night.
important.
Yes, to
Yeah.
change between 12 and 2 and to have
Hmm.
hot soup and then to have as little possible as little processed as possible foods, steamed vegetables, and then of course he would add a little bit of mustard or a little bit of mayo, but slowly. But this was all not frozen dinner that he would put in microwave, take out and eat. This would
Right.
be something that he would make it himself.
Yeah, it's
And
really important to, make them aware what they are eating and what they should eat. Because
yes,
sometimes people are not able to differentiate what's right for their body. And Ayurveda is all about, individualized diet plan, individualized treatment as per your body, as per your doshas. So it's really good that you advised according to his body, and gradually things should go up. It should not be like always, it should be gradual, not like a sudden change for a body to adjust to the new habits.
exactly, exactly. And that's why we work so closely with our patients. At the end of the meal, he would have the fennel or cumin seeds, couple of seeds, like 5 to 7 seeds, and he would chew it. And he would always drink a little bit of warm or room temperature water. Before he had ice water that even slow down even more his digestion
Exactly.
and create even more toxin in his intestines that went directly to his bloodstream. And because he had a lot of toxins, then I also asked him to add 1 teaspoon of turmeric every day, to either to his tea or to tea with milk, or sometimes to his rice, to really strengthen his liver, right?
Mhm.
At the end, since he was hungry less, but still in many frequent occasions during the day, I asked him, okay, so let's change the 5 meals a day or 7 meals a day into one smaller one for breakfast, the big one that you can eat as much as you can, but not processed foods, and then a smaller one at around 5, 6 p.m., no later than that. And that for that, I would ask him to work on his microbiome because his microbiome was almost completely gone after
Yeah.
all these years of antibiotics. And without proper bacteria in our intestines, we can't digest properly. We can have vitamin B complex, right? So we also decided to have the vitamin B supplements for the first month when before his bacteria start producing and working in symbiosis with his guts.
I
Uh,
think that's the reason we advise probiotics for such patients
yes,
because they need it to take back their good gut bacteria that can help with the better digestion. And also, small meals rather than big portion of the meals will always be a good option for IBS patients.
yes,
As
yes,
you mentioned, yeah.
you are absolutely right. But remember that this was also a negotiation because he had incredible appetite. He said he would call himself me and my belly, you know. So this was like two persons. This is the reality that we are talking about. So, yes, so for that, absolutely, if you overeat, then your belly will have even more problems digesting and metabolizing everything.
Yeah,
That's why I tried also maybe steamed vegetables. More fiber really helps with cleansing of your villi in the intestines.
intestines, yeah.
Yes, so we definitely had this element. Then we had trifala, and here at night with glass of warm water. The trifala, he was not really fond of the pills, so we switched to the trifala juice. and we added with cranberry and a little bit of apple juice, so it was not so bitter and astringent.
Stringent, yeah. It's hard to take that.
Yeah, it is. It
I
is.
know.
Yes, he remember he grew up on processed foods, so this was totally new. How can
You.
something taste like
Just the
this?
opposite
Oh,
one. Yeah.
yeah, it's not ketchup. Yeah. So basically, it took also a little bit of convincing, but he started going because he saw the effects every morning when he woke up, had a glass of hot water, and then he would go to the bathroom. So he was actually shocked that he can every day he can be regular. This was something totally new for him. And then slowly we also started incorporating fresh cinnamon to lower the insulin resistance. This was added to his
Good.
teas and to his coffees. We tried to reduce the coffee because he had the beginning of anemia. And cardamom also worked very well with him. Shatavari strengthened him up and things like this. And all of the herbs, he was actually not thinking of them as medication because they were freshly ground. And he started noticing the smell and the taste of foods. And this was something really unusual for him because he said, well, I eat the food when I'm hungry to get the energy, full stop.
Hard to control the hunger for sometimes, Yeah.
Yes, yes. And then he started also lowering the volume of the food, so and the frequency of the meals. It took us a little bit of while, like a couple of months, to start getting really the healthy diet, but it works, and I keep my fingers crossed for my patient, and I hope.
No, it was really good what you advised in the diet or in the herbal supplements. It's all good. It's gonna finally work out.
Yeah, I really hope. And right now he also has a little bit of shilajit to improve his mineral content in his blood. And
Okay.
of course, also started walking and exercising more because before that he was really he didn't have energy because he had so much food that was processed that and the glucose curve.
Bye.
This was his life. He didn't know that he can even exercise.
I would like to add 2 points from my side, maybe to the case that you
Sure.
presented. So IBS, as we talked, it's more of physical as well as mental connection. So
Yeah.
when we have physical symptoms that you told, I won't repeat that, like abdominal pain, bleeding. So one of the remedy or one of the thing that I used to advise was, pomegranates peel,
Yes.
the outer part. We just take that. Just seeds, take that out separately, seeds and the peel, just boil that in a normal water, like make a decoction out of that. And it was such a great thing that helped most of my patients with
Ah.
anemia, with the number of frequent going to the toilet reduced, bleeding reduced, and it also covers up the anemic part as well.
Hmm.
So that's easy, and you can advise that to your patients as well.
Thank you.
And
Astringent,
secondly,
right? Quality.
astringent,
Yes.
right? No need to add anything. It's easy to drink like that.
Okay.
And secondly, as we said, that it's psychological as well, mental connection there. So we can add more some of the herbs like Brahmi that we always talk about because it helps to calm down the stress factors. Because Ayurveda always says just to work on the causative factors first rather than just, giving the medicines
Sure.
randomly. So it's always good to do Nidan Parivarjana, work on the causative factors first, remove all the causative factors causing you the problem, and then come to the point of treatment where even after removing the causative factors, you are still having the problem. It means you need treatment now. So that's how Ayurveda works. So I
And
hope this will help. Yeah.
this is a really important point that I didn't even start discussing. Whenever he had projects due, he would start developing cramps, abdominal cramps. So we
Will
went
increase. Yeah,
breathing. Yes,
definitely.
breathing exercises helped him also. But
I have
absolutely,
seen it very closely. Whenever the IBS patient is under stress, any anxiety, either it is a work stress or a personal level stress, the IBS symptoms always go up.
exactly.
Always go up.
Well,
Yeah,
they say that our intestines is our second brain, right?
yeah. Gut
Yeah.
is the second brain. We should make it that healthy that we try to make this one healthy.
Yeah.
Equally important. Yeah,
Okay. Thank you, Dr. Kamal.
yeah, for sure. Anytime.
And yes, and then let's go back. Let's introduce patient number two. Uh, Patient number two, she is a 33-year-old female with GERD, very severe heartburns. And one of the reasons, of course, also anemia, typical for total vata imbalance, Vikriti. She totally, my patient forgets about eating, and whenever she can go, she can wake up. She likes to have coffee with milk and sugar for breakfast, then goes out, and then at 5, 6 p.m., she decides that this is the time to eat. So, she, of course, she has no energy, so she eats something sweet, right?
Right.
Yes. And very often in cases like this, with patients, with our patients, they also have candida. And candida is just the weakened microbiome of our guts, right? So
Right.
this lady also has candida. She, because of candida, I think she has a lot of toxins in her bloodstream. Very often she has headaches. She has problems sleeping. And yes, and she's open to any suggestions, but she cannot really follow and be strict with the suggestions for longer than a week. So this is another challenge that we have with this
Bigger
lady.
challenge.
Yes. Yeah. So one of the things about heartburns and GERD, first, it's always good to diagnose if there is an H. pylori bacteria in the stomach. In her stomach,
Pylori, yeah. That's
yeah,
true.
in her
Hard to get it
stomach,
out of the body.
yes, it is very
Very
hard.
stubborn.
Yeah.
Yeah.
So she didn't have H. pylori. She just
Mm-hmm.
had candida and very, very small stomach. And being totally convinced that she does everything that she needs to be healthy and to live a happy and healthy life. So this was another big challenge. So first we started with convincing her how Ayurveda can help. She was on antibiotics for Candida. She had many different herbal supplements taking, just went on the internet and just typed in Candida and decided that this was the favorite herb of the month. And then, of course, after 2 weeks, she would forget, and that's how it goes. So her skin was dry. She was extremely dry, but this is again typical for Vata, for
Vata.
air
Right.
imbalance. And so we started I started asking her what is important here. What is important for her? Is the quality of life important? Is the energy important? And she would say that the most important thing for her is the constipation, the pain that she has with heartburn, and the dryness. Everywhere she feels dry. And she is
Yeah.
just 33-year-old. Please remember that. She should not be dry. So we
Ayurveda says naturally Vata increases once you go beyond 50s and 60s, like when you start aging. That's
yes,
the time that your body should at least start having the dryness sort of thing. Otherwise, you should not have that, yeah, as a
exactly.
healthy, this, especially in this reproductive age.
Yeah. So I also noticed that she uses very extreme body balms and body creams, very full of chemicals. So I tried to convince her. In the beginning, she was resilient. She didn't want to accept throwing away all of the creams to introduce Abhyanga. So she came to our practice, and we went over with Abhyanga. putting on her first, doing Abhyanga to her, and then she did it to herself. She liked it, and this was the first thing. Then I introduced her to clarified butter. So before she went to sleep, she would have a hot cup of hot water with a spoon of clarified butter. She liked that
That's
too. Yeah, she said she liked it. Slowly, then we introduce the main meal of the day between 12 and 2. That needs to be with soup and needs to be hot. Then she needs to have a lot of nutrients. Being Vata, she needed to have she needs to eat a lot of nuts at least in this stage of her reconvalescence. So she went through that. Okay, she was ready to accept that. She actually liked it because I taught her how to do the laddu, the sugar-free laddu, with nuts, with dates,
I
and
think
with
everyone likes it.
ah, I love it, and I shouldn't. So she liked that. She had 1 to 2 ladus in the morning with her coffee. I asked her to change the coffee to herbal teas. This is has not happened yet, but slowly I hope that one day she will not drink so much coffee.
Important to give your patient some time to adapt, you know. Otherwise, it's like you are forcing them and they won't do it at all. Always to
Exactly.
give some time and make it a gradual habit, always.
Exactly, finding the acceptable substitute, and so that's I think this is the hardest thing because our bodies are so strong. Once we when we have the right diagnosis, we'll for sure be better. But we need to find the substitute that are acceptable for patients. So
Most of my patients
yes.
always struggle about following a particular diet plan. They
Mm,
will take the medicines, they will take all the supplements, they will start doing other activities, but the diet, that's very hard. Like for 90% of my patients, they are just complaining, oh God, what you have given in this diet plan, I can't do that. Just give me any other substitute. So it's
yes,
always
yes.
hard to, change your diet, what you are eating since ages, and somebody just come out and say, okay, just stop eating it all. It's really
And
harsh.
it is very harsh, and it is even more difficult. In her case, she has kids, so her kids will not change. So every morning, her kids have the same, like sweet breakfast, and she's like, I can't have it. And then once
Right?
every 4 to 5 days, she would, aha, just one day, one breakfast,
Just cheat day.
and then the candida would grow again, and then she would have heartburn problems and all of this. So yes, so this is your environment that you choose for the getting better period. It's also very important, absolutely. So anyway, I am working with her with I introduced her to guduchi and neem for the anti-candida herbs. She is on warm diet. She does abhyanga to herself every day. And she also reads a lot because she wants to understand the condition, how she really arrived at here at this place, painful place. So I give her a lot of books to read, and then I tell her that her intuition is the most important. And once, if she learns the right information, then she can really heal herself with the help right now of the Ayurvedic practitioner. So this is, I know we are almost done with this recording. I just wanted to tell her that she is an incredible woman and that I really appreciate her stubbornness to get better. And I'm sure that she will do it in a couple of
Right.
months.
And for this, I would like to give my piece of advice as well so that it can help her get better quickly. So, for this cases like GERD, we should tell our other viewers as well. It's like gastroesophageal reflux disease, where you feel like whenever you eat, it's coming back out like, sour vomit or something, and
Yes.
you feel like trash in your mouth, and you don't feel the tastes of different kind of foods. So there is a thumb rule that you should take care about like three things. First is hurry, curry, and worry. Never eat in a hurry. Sometimes, as I told you in the IBS case as well. Second is curry. Like curry here specifies most of the spices. Try to avoid more spices. And third one is worry. I think the two cases that we have discussed are interconnected because both have a very common factors, causative factors like worry, stress, anxiety, and eating in a very hurry like this. So it's always good to take care of all these things so that you can have better digestion because your whole body depends on your digestion. If your digestion is good, you are good, no matter what other kind of pains you have in your body. So we
Absolutely.
always treat your digestion first. Whenever a patient comes to an Ayurvedic doctor, we always focus on the digestion part and then move to the other parts. So
And
that's the thing.
exactly. And one more thing that I remember right now, she, because she had such small stomach, she also had very little appetite. So what worked for her was 1 to 2 slices of fresh ginger, 15, 20
Hmm.
minutes before the meal. She would she choose the slices of ginger, and then she gets a little bit more hungry and she eats more.
Yeah, that's a very good thing to do because ginger helps to increase your appetite and also help with the digestion later on.
Yeah.
So it's a very good thing to have if you have bad digestion or diarrhea, constipation, whatever. But still, you should have a consult first and then go ahead with these things. Always
Absolutely.
good to have that.
Yes, and also, as you very eloquently described GERD, one of GERD and heartburn, very often we think that this is because we have too much of the hydrochloric acid, of the enzymes and acids in the stomach. But very often, as it has been proved by science, it's because we don't have enough of the acid in our stomach. So
Right.
yes. So this is also
And
something
also,
important.
it's better to go for, examinations so that, if you have any ulcers in the stomach or anything in the esophageal tract, always good to have a track of that rather than just, taking the medicines from random places.
Yeah.
Always good to have a proper diagnosis and then start your treatment.
Exactly, and stick to your treatment. Like my 33-year-old patient, she would, for 1 year, she would just every month type in candida or heartburn, and she would find different diseases, different herbs, and different pills. She would buy it, and after 2 weeks, she realizes that they do not work. She forgets about them, and she orders new panacea. So that is not good. And remember that. Heartburn, because it is very often 80 or 90% due to not enough hydrochloric acid in your stomach. If you buy the classical over the counter from the pharmacy heartburn medication, you'll get even less of the hydrochloric acid. And the less hydrochloric acid means that you have a high chance of getting parasites because you don't have the natural barrier
Right.
with the
Natural
acid.
defense, yeah.
Exactly. So that's why in the beginning you need to really go visit a professional specialist, and then once you understand your condition, you can start really doing more on yourself.
It's really good.
Yes.
Two of the very important topics and a very serious ones. So thank you for telling us a lot about these two, and maybe we can discuss more about such topics later in our videos.
Yes. So next week, I believe it's your turn, Dr. Kamal, right?
Yeah, definitely.
Okay, we are looking forward to it. Thank you for listening, and thank you for sending us questions. We really appreciate it. And please remember to subscribe. Even when it is so hot, do not forget to subscribe.
That is true.
Okay.
Okay, thank you.